Excellent. Well, thank you very much, everyone. Thank you for your patience waiting a few extra moments just as some others were coming in. So today is a first sneak peek into updates and a new service coming from Public View. But before I go into that, let me start by introducing myself. My name is Thomas Ridgeway, and I'm the founder of Public View. Before creating Public View, I worked in the NHS for 10 years in a variety of operational roles. And for those of you that might not be fully familiar with Public View is a service that brings together all known data sets about NHS organisations that exist in the public domain. And we bring that together to enable non-analysts in particular, but many analysts also use our service, to review and compare information over 1,200 indicators in an intuitive and simple to use platform. Behind the scenes exists a database with a further 20,000 indicators for those that want to go into a bit more depth and perhaps look at indicators in a slightly different way to do so. The platform's connected to 170 different websites, so that as soon as new data is put into the public domain, it's available to view. In today's session, I'm going to take you through some of the changes and some of the upgrades that will be released in the coming days, and provide a first look at a new service we will be releasing shortly, which automates the creation of performance reports. I'm now going to share my screen. Please be aware that what we're looking at is our test system, and as such, we may experience some unexpected errors. Please accept my apologies in advance if this is to happen. We're still working on the product, and as such, we'd really value any thoughts you have on how it can be improved to better meet your needs. Okay, if I can just get a thumbs up from someone just to say that my screen is sharing, that would be very much appreciated. Perfect. Thank you ever so much, Liam and Janice. I appreciate that a lot. Excellent. So we're looking at the new update version of Public View. Just something to note, you are going to see that the data is significantly out of date. This is because we're working on a test database. The current live system is over here. And so we can have a quick look at that and see that the data is far more contemporaneous. Now, tomorrow is Big Data Thursday, and so that's when 50 to 60% of the indicators put in the public domain get updated. So tomorrow you'll see lots and lots and lots of new information, those that have access to Public View already. But we're going to focus on Public View's updates, upgrades, and new features coming online. So the first change those with eagle eyes might have spotted is that we've changed the SPC icons. On the current live system, there are two smaller SPC icons, one for variation and one for assurance. Following feedback, we're changing this to a single variation icon, which we hope will make things much, much easier to review. When you do click through to the charts and you go to the SPC tab, you will still see both the variation and assurance icons. And so as you want to look into data with a bit more information, of course, we have all of these different charts still available. The SPC, ranking charts, delta charts, which shows which trusts have improved most, which are deteriorated, heat maps for the ICS, sibling indicators related to the ones you're looking at, raw data with numerator and denominators, and a details page where you have the definition of the indicator, link to the original public source, numerator and denominator values, and other information that might be of use to you. Now, I'm just going to quickly jump back over here to this default performance page. Now, the first of the upgrades I want to take you through is the ability to create your own custom scorecards. Now, that ability has been in Public View for a bit of time now, but it was done on the request of a customer, and we assumed that they were the only one that would want to do that. So we kind of built it in a bit of okay, here's a few steps to do it. But we realize that many customers want to be able to create their own custom scorecards. So we've made this much easier. To do that, you go to the drop-down menu, and at the top, you will see scorecards that we have created that are available for everyone across that uses public view. So if you want a scorecard that just looks at A&E performance, you just click on A&E. If you just want to look at maternity, you'll click on maternity. If you just want to see mental health indicators, you'll just click mental health. And if you only want to see those on the single operating framework, you can click that and those others that are on there too. We'll come on to this split between organisation scorecards and my scorecards in a moment. But before we do, let's create a new scorecard. So to do that, we'll click Add New Scorecard, and we'll see this pop-out window has appeared. And for this, we can then create a new scorecard, and we'll give it a name. So we'll call this the Webinar Example Scorecard. And all we then need to do is search for indicators we want to include in this scorecard. So perhaps we want an A&E indicator. So we'll type in A&E, and all of the indicators that have A&E in their name will be there. And we'll add a couple of these. Perhaps we also want to have some mental health indicators. If we were both an acute and a mental health trust, maybe we would want to add in something such as IAPT. And so we'll type in IAPT, and we'll look at those that have waited less than 6 weeks and those waited less than 18 weeks. Perhaps we might also want to look at some workforce indicators such as sickness absence. And we'll see sickness absence for different staff groups, and perhaps we want it for all staff. And maybe we also want to look at the sickness absence amongst doctors. And maybe we also want something here for mortality. So we'll type in mortality and add in a mortality indicator. As you can see, we build up these indicators, and there's a maximum 30 indicators for a scorecard, and it will become apparent later on why we've set that limit as 30. Now, you have an unlimited number of scorecards that you can make. So if you need to have a scorecard with more than 30, I'd recommend building a page 1 and a page 2. However, if it does become a particular problem, do provide me with feedback on that, and we'll see what we can do to maybe create a page 1, page 2 separation, but it's all in one scorecard. Anyway, we'll click Save. And that scorecard now exists under My Scorecards section, just here. And anytime I want to edit it, I can edit that scorecard and add new metrics, take away metrics, or change the name of it. But what I can also do, and this is a particularly, we've had many requests for this feature, is the ability to share that scorecard. And you'll click this share icon, and you'll have the option here to either share with your whole organization or share to specific individuals. Just a point to note, the ability to share with a whole organization is limited to only those with the highest level of admin access on your system, on public view. Now, you can designate anyone to have admin access, but you have those different level users, and so in effect, you won't have to. That way, hopefully, it won't clutter things up for you. Or you share with specific individuals. So perhaps you've got a colleague you want to share with. So, for example, I want to share with my colleague Taryn. And so I will search for Taryn, add him onto it, and press share. Taryn now has access to the webinar example scorecard that we've just created. When I look at those scorecards, I will see that there is a person icon on there, which means I know I have shared this scorecard. And I can click on that and manage the users on there. Those organization level scorecards, those ones that we've defined and said, actually, we want the whole organization to see, they exist on organization scorecards. And my scorecards that I've made for myself, or ones that an individual has shared with you, they'll appear under this My Scorecards list. So the 3 layers of scorecards that everyone in public public you can see, scorecards that only those in your organisation can see, and scorecards that only you and those you have individually shared the scorecard can see. And of course, here you can make different ones for different committees, for different teams. Maybe you've got a nursing team or medical team, different divisional scorecards as well. We're going to have a little look at a finance and performance committee scorecard that I made earlier, and it's just a rough mix of mainly we're looking at an acute hospital here, but acute indicators. Just for note, because all of the data is in the public domain, you have the ability to look at any other organization's data that exists in the public domain. So if you wanted to look at Southampton's information, we'll just click Southampton and it'll take a couple of seconds to load, and we now see Southampton's scorecard. Or if we want to go further afield, you'll see that those in your ICS will appear in these quick links, but you can still go further away. So perhaps we want to look at Northern Care Alliance, and we'll just type in the name Northern Care Alliance, and again, a couple of seconds, we have their indicator. I'm just going to go back to Hampshire Hospitals, but just to note, there are two separate versions of Public View, one that's a provider-only version and one that is an ICS and is inclusive of every single type of organisation. So for the ICS, exactly the same, but it provides an aggregated view and a split out by the providers or a split out by the CCGs or places, as they're being referred to now. And so you can see your place level scorecard, as long as that place is continuing to submit information in the public domain as the place rather than an amalgamated one. And we notice half of ICSs have moved to a single amalgamated version and half are still submitting place level information. But if it is still submit place level information, that will exist there too. We're just going to go back to Hampshire Hospitals now, and as we proceed on. So that covers the first feature in terms of the ability to create and share your custom built scorecards. The next feature is the ability to set a custom target. The target by default is set at the national standard for the NHS, and where there is not a national set standard, such as the 95% current constitutional standard for A&E, which we understand moves to 76 in April, and we will update that target in April when that becomes the official target. We use the historic national average. What you have been able to do for quite some time is set your target to a peer group. And for those of you that use Public View, you'll know that you can have 4 different peer groups. And we've currently got those peer groups defined for CQC rating: outstanding, good, requires improvement, and inadequate. So you could set your target to good, and this will provide the current average performance of a CQC rated good hospital. You can compare directly to that. But equally, you can compare it, you can set up a peer group of your ICS or a specific other organisation, or perhaps those that are in your recommended grouping. What you can now also do is add your own custom target. Now, you used to be able to do this through a bit of a process by getting in contact with us, but we've now brought the ability that you can do that directly yourself. So perhaps you have some new targets for your 2023-24 contract. So we'll we'll call this target group 2023-24. You can then, for each indicator, set the targets that cover this contract period. Note that any indicator that you don't set your own custom target for, it will use the default currently in Public View. But let's do an example. Let's take A&E for our standard, and apologies to those that are not in acute services. I know it's been a bit. I will, on my next indicator, I will do something that is mental health orientated, and maybe community, and maybe ambulance, so because we do cover the full range of healthcare data. But what we can do is we're going to say, right, we're going to set a target for the 4-hour standard. And you have a choice. You can either set it as a constant target, and you will say between April 23 and March 24, we want that target to be 76%. But we know that the target in the standard operating framework is to achieve 76% by March 2024. So perhaps you're not going to set that target as your target right from the start. Perhaps you're going to set a profile target. And that profile target will give you give you the ability to input a different value each month. So maybe it's a gradual rise up there. And so we can just update those month by month as we wish to do so. And perhaps we go, do you know what? We know that winter's going to be tough, so we take it down to 65, and then 65, and then 60, and then it comes back up to 70 before being at 76, and we say after March 24th, stay at 76 forever. We can make that target. Now I'm going to click save on that. And that 2023-24 contract is available for us to select. Note, it hasn't changed that target there. It's still saying 95%, and that's because on this, where we're looking at compared to September. Remember, we're looking at out-of-date information because we're on the test system. The live system's much more up to date, but the test system, we're a bit behind. So what we'll do is I'll just show you the test target, because on the test target, I set this up to start at January 2022. So therefore covering the range. And you can see that we've changed that target to 60%. So it's gone green. We're achieving what we set out to do. And now when we look at the trend chart, and I'm just going to take away these CQC peer group colors just to make it easier to view, we can now see the target line, how it shifts between month to month, and compare that to our performance time. And again, of course, we can add back in those CQC ratings or any other peer group we might have set up in order to take a look at that. Just a quick reminder, you have the ability to view up to 5 years information on a chart, anywhere in between. And you can also set that information to show the actual month, a 3-month rolling average, 6-month rolling average, or 12-month rolling average. Some indicators really do show much stronger correlations to certain groups if you use a 12-month rolling average. Of course, also we have the different peer groups as presets here. So by default, we use the NHS average and your ICS average. We have CQC, we have it split by size of organization, type of service, those that are related to you in terms of region, area, those that are recommended in terms of by their underlying characteristics of size and demographics, the most similar, those that are in your ICS, and you'll get a different, if I click on that, you then get a different line for each of the organizations in the ICS and the oversight and the NHSE oversight framework. So just a quick note of features that already exist that you can add in there. One of the other key improvements we've made is those that use public view, there's a commentary tab. There is currently a commentary tab that sits, if I go to a home or the right organization where I've got the ability to do commentaries. Sorry about this, everyone. Let me just go back. The commentary tab sits by the side where an admin can add a commentary such as this. And that commentary is available for those reviewing to see. In the latest version, in the new version of Public View, any comments that an admin for the account has made will appear beneath the charts. So you don't need to click away to view it. And as an admin, you don't need to click away to add the commentary either. Just a quick word of note, whilst all data in the public domain is available for any organisation to see, anything you contribute will only be seen by those in your organisation. So that includes any comments you make, any data that you locally upload, and so you have the ability to upload more up-to-date information. And also, again, it has existed for a bit of time in public view, the ability to create your own indicators. Now, if you go to the everything page and look at those indicators with a star, these are indicators that another organization somewhere in the country has created. And you can choose to adopt that indicator if you want, but you will never see the information that that organization has submitted against it. So you can't use it for benchmarking, but it is there if you wish to do it. So yes, the ability to add more up-to-date data, add indicators that don't exist in the public domain, create your own custom scorecards, share those scorecards, create your own custom targets, share those targets, changes to how the commentary is laid out to make it much more intuitive and related to the charts you're looking at rather than separating away, and slightly easier visualization of the SPC icons. We hope all of these really help in your interactions with public view. Now, I'm not going to do a deep dive into all aspects of public view today. We will hold more regular webinars where people can come and we'll, again, do half of it as a tutorial to go over the features and half of it in terms of new things. So just to say, all of these features I've covered, they exist within our standard subscription arrangements. And so all of you that currently access public view, these updates, you will see them go live in the next few days. We are just in our final stages of testing of all of these updates. And if you have any queries at all at any point, just remember at the bottom of every page is a contact us button. If you click that contact us button, you will then be able to share a screenshot of what you're looking at if something doesn't make sense, and also include a message. So if ever you need any help, just click that contact us button and one of us will be on with you to make sure that we can help you out where you need some help. So on to the new service then that public view is going to be offering shortly. And please do feel free to ask questions in the chat. I'll keep an eye on the chat and look to integrate them in. So we're halfway through in terms of what we're doing today. So do drop in questions if there's anything that I've been a bit unclear about. And if there's no questions, I'll assume that I'm being perfectly clear of my explanations, which might be a bit of a first. So the next feature is the ability, so I say feature, new service is the ability to automate the creation of reports, and specifically PowerPoint reports. Now, to start off with, we're going to be, this will come as an option for public view subscribers to the benchmarking service. But in the future, this will also exist as a standalone product that you can connect direct into your own data warehouse, and you'll be able to go through a wizard setup and it will automate those reports for you. So I'm just going to go through the process. So we will click Create Report. And when we go to Create Report, we have two things that we need to set up. Both of these, once you've set up, you never need to set up again, although you can. The first of which is the style of the PowerPoint report. So we'll click on Style, and you will have the NHS standard style, those that are on the NHS England Communications Guide website with all the right colours, the logos and things like that, exist in here, but you can select that style. You can then create your own styles. So here's one I made with public view, where You can upload your own logo. Decide if it appears on the right side or the left side. Change the color of the background. So if I don't know, I'm going to copy and paste my heading hex number here. So you just need to know the hex number for it. And then you can select how that background appears. Now I'm just going to do it on a white background today. You can select the color for your heading text, color for your body text, and we might add in some more features in terms of maybe what font you want. So, and here's one I made earlier for Hampshire Hospitals. And again, adding in that Hampshire Hospitals logo. And this one has a slightly more garish heading color, that bold magenta, just to show you do have full flexibility on that. So, with great responsibility, with great power comes great responsibility, I think Spider-Man said, wasn't it? So we can, whilst you've got all of those colors, make sure it looks nice. Anyway, so that's just a bit of an extreme example. Now, once we've got those styles set up, you'll then want to set up your templates. And to do that, we'll click on templates. And here you will set up your export template. And here's some I built earlier in terms of for the ICB acute care collaboration, for the medical division, for quality committee, the surgical division, the trust executive group. We've built those. But I want to build one for this demo for the finance and performance committee. So we're going to call it finance and performance. And because we're looking at Hampshire hospitals, I'm going to, by default, put it on the Hampshire hospital format. Now you can change that later, as it says. When we go to select it, you can change that later. Now, I've just discovered a bug. You'll see there's Finance and Performance Committee available as a scorecard, and that should be appearing in my Finance and Performance list over here. This is the great thing about live demos. They go wrong on you, because I was going to do the Finance and Performance Committee scorecard. Let me just quickly move that across. And I'm going to try and live bug fix why that might be the case. Might not be able to. It's got 30 indicators and 30 is the limit. Just bear with me 1 second. I'm just going to remove one indicator and see if removing one indicator makes it work, and accidentally we've set the limit as at 29. Apologies for doing this testing live in front of you. Let's see if that has improved it. So again, we started something, it's there. Well, it's not working, is it? So we'll just pretend that it is working and know it will be before it goes live. I think there must be some save button I've not pressed. So what we'll do is we'll just build one. And so we'll go, right, we'll use the A&E scorecard here. Let's do the A&E scorecard. And beneath the A&E scorecard, we'll go, well, we want some A&E indicators. So we'll type A&E and we'll add in some A&E indicators, just like that. And you can move those around as well. If you want an indicator above the scorecard or below, or change the order, you can. And you can also choose to toggle on your peer groups on and off too. And so I'm going to add on peer groups for the 4-hour standard. Now, just note, you'll want to go to your peers page because it will take the peers that are set up. So if these are the peers you want, that's great. But equally, you can change them around, save and go back. So you get the peers set up as, here we go. I didn't press save on that template, so I'm going to have to do that part again. Move that across, move that back, put that over. Do remember to press save, otherwise you look a bit foolish like I have just made myself do. So put there. Perhaps we also want a cancer scorecard. So we'll put the cancer scorecard across there, and we'll put in some cancer indicators. Once again, apologies to those mental health and community organisations. I've been rather neglectful and not preset up. Oh, here we go. We've got, if I do mental health doing it at Hampshire, it won't bring anything across. If we have time, we'll do one specific for you over there. Oh, Finance and Performance Committee has just appeared. Well, we'll do Finance and Performance Committee as well then. put that in. So we've got another scorecard, and maybe the Finance and Performance Committee is also looking at length of stay. So let's add in a length of stay indicator, and they're also looking at the elective recovery. So we'll add in some elective recovery for day surgery, just as examples on there. And we've put peer groups on for 4-hour standard, and we'll put peer groups on for, oh, I don't know, let's go for cancer as well. So we've now built a template to share. We're going to save that template, making sure we don't forget, and that's just there. And again, here, you can share this to either the whole organization or specific individuals, exactly the same as we did before. You can share it around, make it a favorite. If you end up with lots and lots and lots, because you can make unlimited numbers for all of your different committees and all of your different presentations, and then they're just updated automatically with the latest data, you can toggle a favorite, and then that will appear in your favorites item as well if you want to have some quick ones. But right, so we've built those. Now on to the export. So we want the Finance and Performance Committee template that we've built. We could choose any of the other ones that has either been built or shared with us. And we're going to put it on the Hampshire Hospital style, and we'll just call it Finance and Performance. And the latest data on this test version is October 2022. Again, reminding those that joined late, if you are in the live version, the data is up to date with the latest data published today. Oh, look, for those that don't use public view, when an indicator goes bold, that means new data published in the last 24 hours. So whilst we've been talking, it looks like all of the infections data got updated. So March, just to say that that's there. Okay, that's now ready for us to export. And we're going to press the, also we have a preview here. And the preview will show you what each slide looks like. So it's each slide type. So you see the front page, the contents page, what a scorecard page will look like, and what a metric page will look like. Note that if you have written a commentary, that commentary will automatically be filled in this narrative box over here. So we'll export that. And what's happening whilst that's, when we press that export, is a message has come to our servers to, for all of those scorecards and indicators, oh dear, we've hit a bug. For all of those scorecards and indicators, go to those websites and go to each of those pages, take a screenshot, put it into a PowerPoint presentation, put it all in the right place, save that, and then send it back to us. Now, rather disappointingly, as happens on these test things, we've hit an error. So I'm going to just pause that, refresh the page, and we're going to try again with just we'll try again and see if we can get this. I'm just going to test and we'll see if it works. And if it doesn't, I'm afraid I'm going to have to do here's one I made earlier. And you're going to have to trust me that it did work this morning. Okay, it's not working, but trust me, it did work this morning. And I am now going to go to my I'm just going to go and get an example up and just reshare my screen with PowerPoint so you can see how it will actually work. So stop sharing there and share a. So here's one I made earlier. Again, so we have that layout on there, and it does take 10 seconds when it's working, and obviously something's gone wrong. We'll have the name of the report. We'll have the name of the scorecard that we made, and obviously this was a demo to Newcastle where I did this. So we have the Newcastle report and we have the indicators. So we'll have the we'll have the scorecard just here. There's also space to the side for a text box. So if you want to write a commentary on here, you can. But what we've also done is we have deliberately made the scorecard exactly half the width of the presentation. So if you wanted to, you can get two scorecards side by side together, extract them separately, and just put them next to each other.
Tom, just quickly, Tim has just asked a question. PowerPoint report, do you see all of the historic comments? And if so, can you easily delete old comments that may no longer be relevant?
Yes, absolutely. So all historic comments that have been made that are live in the system, so maybe you've deleted them out the system, so you can delete them out the system, but all comments that are currently live in the system, you will see. But as we move on to the metrics page, where we've got again, this one was selected with peer groups on, so we've got with the peer groups, and then we've got another indicator with no peer groups on. Those are there. And in this narrative section will come through as a fully editable text box. So you can change. In this, you will be able to edit, change, and delete. That's all available for you. Also, all of the charts exist as separate images. So if you want to delete one, move it, edit it, it's there for you to do it. If you want to give the charts different names, you can do that. Everything is in a fully editable format for you to interrogate as you wish to interrogate and present as you wish to interrogate. And of course, that enables the default tools that exist within PowerPoint, such that you can, I think there's buttons you can press where you go, design a button, put it in, or even, whilst we have the ability for you to create your own, to create your export, a background, logo, font colors, things like that, you can just change that to your specific design. Perhaps you have got a specific organization design you use, and with a click of a button, if it's saved on your PowerPoint, that will be available for you to use. Now, I feel rather disappointed that demo didn't quite work as we hoped to, and it's errored. As you can see, we're on the test version at the moment and still working on it. Lots of things working really well. Still some bugs to fix and still some features we want to add in. But hopefully that gives you a good idea of what we have been building, where the product's going over the next couple of weeks, what you're going to be able to see and do very shortly, and maybe that's got some juices flowing in terms of how that might be able to save you some time and effort and enable a consistent look and feel across all of your different scorecards, all of your different committees, all of those different parts. And we have had some feedback from organizations that have said, oh, well, yes, just one person as an individual spends every Friday afternoon building a PowerPoint presentation to share at a communications event. And they do that by screenshotting public view and putting it into a presentation. And so this feature will enable them to have every Friday afternoon back. And that's just one person in that organization. Now, if you just use public view only for its benchmarking capabilities, that latter may not serve you as much use. But if you do find yourself taking data in and out and creating presentations and maybe wanting to share benchmark scorecards, we hope that those features are going to make a real big difference. I'm going to stop there and offer up for if there's any questions, for points of clarification, or anything that anyone would like to say, Tom, that's fantastic, but it would be good if, whilst you're still developing it, it would be good if you could do that. Janice, thank you, Janice. On the scorecard share section, if you update a scorecard after you have shared it, do you have to reshare it, or will it automatically update others' view too? It will automatically update others' views too as well, Janice. Now, they may have made a local copy of it, but that will say copy. But if it's connected to you, when you edit it, it will change theirs. Also, on the commentary tab, I don't have commentary box. I checked the A&E standard metric. Is there a reason for this? Janice, yes, that will be because you are not designated an admin for your organization. So only administrators have the ability to write a commentary. And if no commentary has been written, you won't see the commentary box. If you'd like me to make you an admin, just ping me a message and I will set that up for you so you have the ability to do that. Tim, thank you, Tim. Can you have multiple people editing a report, or is it only available for the person who set it up? Any admin can edit any other admin created report. So, for example, if you had someone that was an admin and made a lot of reports and they've then left the organization, well, you will need to be able to delete those and edit those and move those along. So yes, multiple people, but only admins are able to edit the reports. Missed the first 8 minutes. Oh, I'm sorry, missed the first 8 minutes. Can you now set up and edit your own metrics, or do we still need to request them? Still need to request those at the moment, Tim, in terms of that setup. We've got a slightly simpler template to fill in, but we do find that if there's been a little bit, we do just need to do a bit of quality checking, because if it's not quite set up right, it does distort those indicators and does mean that it takes a bit of time. So just a little bit of quality checking, but we are making that process far, far, far more straightforward to do. Kelvin. Thank you, Kelvin. I'm going to stop sharing my screen well, no, I'll keep sharing just in case there's a question related to it. Kelvin, on the scorecard, is it possible to show the England value for each indicator as a separate column to make it easier to compare a trust against the national average? Great question, Kevin. Well, there's a workaround that lets you do it, but I think that's also a wonderful idea for us to think about. So the workaround is that you can use the England peer group. And with the England peer group, you can then set the target to be the England peer group. That provides you a direct compare and contrast to your performance versus England performance. So it is available, but maybe we should have the ability that actually maybe it appears as it could appear as a separate column next to the target, next to you, so you don't miss out on the target on there. Hopefully, Kelvin, that's a useful workaround that you can use in the in-between time, but I'm going to take a note of that and look to see how we can implement something that enables that to happen in our next release version. 10% cut, well, I think that's completely justified, Kelvin. Definitely. We'll have to do that as an add-on feature, everyone, an add-on feature. So if you want that, Kelvin needs a 10% cut of that add-on feature. So we'll have to work that out as it comes forward. But no, thank you ever so much, Kelvin. I do think it will really, really, really help. Okay, well, with 15 minutes left. Oh, Tim, I was about to wrap up there, Tim. Interesting to hear that we can share indicators and use an indicator created by another organization, but question, will the other organization's data be available to benchmark? No, Tim, that's not going to be a functionality that's going to be available coming up soon. No, whilst you can see the indicators, the data is very strictly your own data. We are for ICSs, so where ICSs have taken out an ICS-wide subscription, we are making it available that those within the ICS, they've signed all of the relevant data sharing permissions to say, we let this provider lets the ICS see our local data. We are enabling that. So it is something we have the ability to enable, but we would need to go through some kind of data sharing agreement with organizations in order to do that. It is your data and it is your choice how you present it and what you do. So we haven't yet got that process worked out. Do you think that would be something that many of you would be interested in having the ability to do, would be to share your local data that others can view. Maybe you can view others as well. Perhaps it would be something of, you can't view others' data if you're not letting them view your data. Something like, is that, or maybe you'd want to share only with a specific organization. You'd want to say, well, actually, we do a lot of that over there. So have a think about it. Do feel free to drop me a message if that would be interesting to do. Thank you, Liam. Appreciate the explanations were clear. The video will be made available. So absolutely. Obviously, this has been a test version with errors on it. So, not my finest work, but I was very, very keen to give you the earliest sight possible of what's coming and what you'll be able to do. Thank you ever so much, Liam. And to everyone else, thank you ever so much for attending and staying with me through this conversation. I say conversation, it's a lecture. No one else has said anything. But thank you ever so much for staying with me. And if you do have any feedback or any questions, please get in contact with me. I love receiving the feedback and ideas for how it can be improved. Kelvin, thank you ever so much for contributing that idea. Take care, everyone. I look forward to seeing you again.